transitioning from one activity to another can be tricky, even for adults. Moving from one activity to another is one of many executive functioning skills we use to carry out daily activities. Executive functioning develops shortly after birth. A window of drastic growth of executive functioning skills occurs between the ages of 3 to 5 years old, and improvement of skills generally continues through adulthood. As we age, a decline in executive function skills occurs. But it's never too late for an adult to develop stronger executive functioning skills. This video answers your questions about executive functioning and how professional coaching can help. Executive functioning skills allow individuals to prioritize tasks and correctly sequence needed behaviors to complete them efficiently. Skills like planning and organizing are crucial to success at work, school, and in daily life. At every stage of development, these skills are necessary to manage our home and thrive in our careers, which is why we need to be aware of how executive function disorder can affect our lives. Executive function disorder, or EFD, is an umbrella term for a cluster of behavioral symptoms characterized by difficulties in self-regulation, planning, shifting focus, or managing time appropriately. Individuals with weak executive functioning skills may have problems completing common tasks, such as getting dressed, doing the laundry, packing a suitcase, or grocery shopping. Some conditions that may contribute to a person having symptoms of EFD include autism spectrum disorder, or ASD, ADHD, anxiety, depression, brain injury, chronic pain, or Alzheimer's disease. Some factors can also temporarily lead to executive function issues, including alcohol and drug abuse, sleep deprivation, severe pain, exhaustion, and stress. Executive function may be diagnosed informally or through a more formal process, including standardized testing. The gold standard for evaluating executive function is through a neuropsychologist. Speech-language pathologists can also provide an evaluation of executive function. An evaluation will consist of clinical observation, clinical intake, and executive function inventory, and can also include executive function formal testing. Speech pathologists typically factor in input from the individual's neuropsychologist, psychologist, social worker, or school counselor. A speech-language pathologist is the ideal professional to deliver executive function coaching for adults. Speech pathologists are trained to help individuals develop language skills and assist with the social language aspects of executive function, such as initiating interactions, topic maintenance, and ending or wrapping up a conversation. At Connected Speech Pathology, our speech-language pathologists provide direct, one-on-one coaching to address the concerns you may have. We can teach adults and children how to manage multiple activities, including business projects, preparing for presentations, or even homework, all while still finding some downtime. There are two primary approaches that we can use for building and restoring executive function skills: environmental and individual. An environmental approach considers manipulating your surroundings to build executive function skills, like creating a healthy, stable environment at home and in the workplace, reducing anxiety and increasing relaxation, and also maintaining a healthy diet. The individual intervention approach strengthens executive function skills by teaching individuals how to adapt to changes in demanding situations. This includes identifying a core problem, planning a solution, and implementing those solutions. Not all speech-language pathologists are trained to help individuals with executive function challenges. At Connected Speech Pathology, our speech pathologists have training in this area, and our services are provided remotely in the comfort of your home. Start by scheduling a free phone consultation with our lead speech therapist today.